If you took the course on teaching and learning theory, you probably remember the concepts of growth mindset. If not, just as a quick introduction, Carol Dweck, a Stanford professor, has done literally decades of research into the concept of mindset. Put quite simply, people can be identified as either having a growth or fixed mindset. When someone has a fixed mindset, they tend to avoid challenges. They tend to give up easily when they face obstacles. They see effort as worthless, and actually worse than worthless, because it means if I can't do it easily, I must not be very smart. They tend to ignore criticism, and they feel threatened by the success of others. On the other hand, if someone has a growth mindset, they tend to embrace challenges. They persist against obstacles. They see effort as the normal path to mastery. They learn from feedback and criticism, and they're inspired by the success of others. So she further showed in her research that people aren't all one or the other. We might have a growth mindset in some areas and a fixed mindset in others. You see this frequently. For example, imagine a high school student who tells themselves, I'm not any good at math, so they don't put forward any effort, but when it comes to basketball, they persist and practice every day to try to achieve mastery. So they have a growth mindset when it comes to basketball, i.e. they see effort as the road to mastery, but when it comes to math, they don't see much point in putting forward the effort. Dweck also showed that people can be pushed into one mindset or another. Sadly, some of what we do in our education pushes learners into a fixed mindset. For example, when we praise learners for getting something quickly, we're fostering a fixed mindset, i.e. you must be smart because you could do it without much effort. Dweck encourages us as educators to think about praise differently. For example, telling a child who has aced a test, well, you must have worked very hard, rather than you must be very smart. Showing that is the effort that led to the result rather than the level of intelligence. And medical schools can attempt to teach growth mindset, but when medical learners enter into a clinical environment, they may face fixed mindset triggers, particularly in competitive situations. Also, preceptors with a fixed mindset may model that behavior when dealing with feedback on medical errors, which can be very counterproductive for learners.